Ready?
Hello.
Hi, good morning. My name is Doran. I'm one of the nurses here. I'm here to provide patient teaching on nutrition and exercise. May I have your name and date of birth, please?
Christina Clark Street, January 6, 1989.
Congratulations on your new baby. We're just going to pull the curtain for some privacy. My first thing, I want to start off with nutrition. I know that you're currently breastfeeding your baby. I just need to inform you that you should increase your calorie intake between 450 to 500 calories daily. Also, you do want to include omega-3, which would help with the DHA when you're breastfeeding your baby, as your baby needs plenty of nutrients. Also, drink 2 to 3 liters of water daily or a fluid of your choice. You have to include a lot of green vegetables, high in protein, also calcium, because that would also help with the nutrients for your baby. As far as exercise go, I wouldn't expect you to go and start working out. Right now, after you recently just had your baby, you would lose probably up to 20 pounds within the first month. And you gradually will lose weight depending on, when you breastfeed, you tend to lose a little bit more weight than a person who does not breastfeed. Also wanted to let you know that you will need to speak to your physician in regards to diet and exercise. As you may know that because of your increase in calorie and stuff, we need your body to heal. By doing all these exercises all at once, trying to lose the weight quick enough, chances of your body healing fast it's not going to be a good chance of it healing. So just keep up, your fluid intake, increase your calorie intake and your protein, and you should be okay.
Thank you very much.
Thank you so much.
Thank you. Hello.
Hi, good afternoon, ma'am. My name is Corinne Pierre. Today I'm a nurse. I'm going to give you some teaching on how to take care of the baby from the cold. Can you tell me your full name and date of birth, please?
My name is Christina Clark Street, January 6, 1989.
Okay. I'm putting the curtain to give you some privacy. Okay, first, you can clean the umbilical cord with alcohol, and you have to keep it dry and clean. Give the baby a sponge bath instead of tub bath, no wet at all. And you have to fold the diaper away from the stump. And like if you see any sign of infection, you have to clean it with alcohol and call the doctor to make an appointment. And if accidentally you pull it, you have to call the doctor. You have to call the doctor to make an appointment so they can treat it for you. Okay?
Yes.
Thank you.
Hello.
Hi, my name is Jasmine. I'm one of the nurses on the floor today. Can you just tell me your name and date of birth?
My name is Christina Clark Street, January 6, 1989.
Okay, I'm gonna just close this curtain for privacy, and I'm gonna pull up a chair so we can talk about SIDS. SIDS is sudden infant death syndrome. It has nothing to do pertaining to your baby, so I don't want you to get worried about that. It's just something we educate all new moms on. So SIDS usually happens around 6 months. It could happen up to a year, but more likely around before 6 months. So we don't know why it happens, but we have a lot of things that can reduce the risk factors for it. We recommend, I should say, that babies sleep on their backs on hard surfaces, either a crib or a bassinet alone. We don't encourage any pillows, wedges, blankets, even comfort toys in there with them. It's just not safe. If your baby happens to fall asleep in a car seat or a swing, we recommend you take them out of that and put them in the crib or the bassinet. Most of the time, we would like the crib to be in the room with the mother, parents, but we don't want you to sleep with the baby. So within arm's reach is fine, just not in the bed with you. If anyone smokes in the house or even outside the house, we would kind of want them we recommend that they either, I don't know if they smoke or not, or anyone helping you care for the child, that you try to stop smoking or at least know where in the environment that the baby's going to be in, because that increases the risk. Also, maybe a pacifier at night while they're sleeping or napping, just for that stimulation while they're sleeping. That sometimes it helps if they just keep sucking. But other than that, if you follow those kind of recommendations, but again, we don't really know why it happens, so there's no guarantee. And after a year, it usually does not happen, so 6 months is like a halfway mark. After a year, there shouldn't be any worry on that. Do you have any questions for me?
No, thank you very much for the
You're
information.
welcome. Good luck with everything.
Thank you.
Hello. Good afternoon. How are you doing today?
Good.
Congratulations on the baby.
Thank you.
So my name is Christina. I'm the baby nurse for today. And could I have your name and date of birth, please?
My name is Corinthia, and date of birth September 4, 1989.
Thank you very much. We're gonna just pull the curtain right here for a little bit of privacy. So for today, I'm here if it's appropriate, if it's an appropriate time, could I just do a little patient teaching on circumcision? Okay. So we were notified that you are in agreement of doing a circumcision for your infant today, and I'm here to just give you a little bit of information on that.
Okay.
Okay. So for the circumcision, we have two different types of circumcisions that are done. We have the Plastibell, and with the Plastibell, we actually use a disposable plastic. So after you complete the preparation, we'll do the infant by giving a little anesthesia. We'll do a little numbing cream before we use the small needle to insert the anesthesia. After which, we're going to put a little clamp onto the baby's head of the penis, which goes under the foreskin. We'll actually use a little sharp stencil to remove the excess foreskin of the child. With the Plastibell, a ring is left on the penis of the baby and it is not removed until 6 to 12 weeks after the circumcision. You can have the baby shower each day just to get rid of the extra bacteria so it doesn't have a buildup or so forth. You can also use Vaseline or ointment on top of the head of the penis to help with when the child is streaming, it doesn't burn. You can also use Vaseline and a gauze on top of the penis to help it from sticking onto the diaper. So we also have another type called the Gormaco, and with this type we don't have a ring in place. It's pretty much the same procedure as the Plastibell with this one, but we actually have a suture that is tied onto the penis to reduce the flow of the blood when the circumcision will be completed. So there's a little stencil to remove the foreskin also after the suture is put in place. The doctor will also put a gauze on top of the penis. The gauze should not be removed until after 24 hours. That just helps to keep the penis, the little bleed that's coming out. So things that you look for that's abnormal, just in case when you're at home, if your child has any form of warmth, fever, or drainage that are yellow coming from the penis, or if they have excessive bleeding, these are all signs. Swollen areas, these are all signs that an infection maybe could be going on. You would want to go to your emergency room or to your HCP, your primary care doctor. We also, for the swollen penis area, you can, when you're wrapping the diaper, put the penis in an upward position because that helps to minimize the swelling of the infant. Any other form of crying during urination or those stuff, you'd want to notify your PCP also. Is there any other concerns you'd like us to talk about? Any questions?
No, I don't.
Okay, thank you very much. Hope you have a wonderful day.
Thank you.
Congratulations again.
Thank you.